I'm Nicole Edison, and I am a clinical associate in the Division of Minimally Invasive Gynecologic Surgery. Radiofrequency ablation of fibroids is what we call a minimally invasive procedure for fibroids, where using ultrasound guidance, we put a needle into the fibroid, we heat up the fibroid to a certain temperature, and then over the next weeks and months, it actually can die and reabsorb and become smaller, and it's typically a treatment for heavy bleeding. So there are two different types of procedures that are both radiofrequency ablation for fibroids. There is the Sonata, which is an approach where we go through the vagina and put an ultrasound probe into the uterus and then use ultrasound guidance to put a needle into the fibroids around the cavity of the uterus. On the other hand, sometimes there's larger fibroids on the outside of the uterus that can cause bleeding and pain symptoms. And so those we treat with a procedure called Acessa, where we put 2 incisions into the belly. We fill the belly up with air. It's also known as laparoscopy, and then use a probe and a needle to again target those bigger fibroids on the outside. So once it's treated, the treatment is done, and then it just takes time to get to the full effect. There is always a chance whenever we leave the uterus behind that new fibroids can develop over time, but the treated fibroids are treated and don't need any further treatment. And I usually don't get repeat imaging unless the patient is still having symptoms and wants to know how much of a benefit there's been.